Hi, my name's Charlotte and I'm one of the therapeutic radiographers who will be looking after you when you come for your Papillon treatment. Papillon is a type of internal radiotherapy where we send X-rays down a tube to target the tumour cells. At Clatterbridge we use it to treat rectal cancers. On the day of your appointment, please have a light breakfast or a light lunch and continue to take the medications you would normally take unless we've specifically asked you to stop taking something. Please bring a full list of the medications you would normally have, and on the day of the appointment we might need to give you some pain relief, so please bring someone with you to the appointment so you don't need to drive home. When you first arrive, the doctor will take you into a consultation room, go through the process, get your consent and answer any questions that you might have.
Nigel, thanks for coming over. So you're here to have this contact radiotherapy treatment, which is also called Papillon. So what this treatment does is to improve the control of the tumor, reduce the chance of the cancer breaking out again. And I said here possible cure. Cure is something you know after a period, and that period is about 2 years from now. But this treatment will improve your chance of cure. Good. There are side effects, early and late. Early side effects, you get a bit of mucus coming down, a bit windy, but they will pass away. Some people get a bit of discomfort, most people can tolerate it well. The main late side effect is bleeding, which occurs in about 30 to 40% of patients. Not everybody gets that. It's a slick of blood that mixed with stools when you pass motion, maybe once a month, maybe every other week. And that usually settles down after about 6 months to a year. But people who are taking blood thinning tablets and all can have persistent bleeding, and we can do some treatment for that. 1 in 10 people need that, but I don't think that will be necessary in your case. You must understand this is not a standard of care in this country for young fit patients like you. But having said all that, if there is a residual tumor at the end of my treatment, or sometimes the tumor goes away and then comes back later, then you would need to have surgery. And that is what I would strongly recommend, because you're young and fit and your chance of cure is quite high. The chance of the cancer coming back, in our experience with your stage of tumor, is about 20%. I'm 80% certain that we can eradicate the tumor, but only time will tell, and that time is about 2 years from now. If you do need surgery, that will be during that time when the tumor grows back. Is that all right?
I understand.
Okay, so we have to share data with other countries like France, Denmark, and Sweden. It's not your name or date of birth, it's just a number, because they want to know how many we treat, how many we cure, and we need your permission for that.
Of course.
Okay, so I'm going to sign here. Are there any questions you want to ask me?
No, I don't think so.
Okay, I want you to sign on this side. Print your surname, put the date there, your signature first.
After you've finished the consent form, the radiographers will go through a questionnaire regarding any other health conditions and do a set of observations. Following this, we will give you a gown, some shorts and some theatre socks to put on before we give you the bowel prep, which is 2 microenemas to empty out the bottom section of your rectum.
Some lovely fetching shorts, and at the back is a tiny little window, so if you just make sure that this is on your bottom. Okay.
Once you've had your enema and you've emptied your bowels, we'll take you through into the treatment room and we'll get you lying on the bed on your back with your feet up in the air in stirrups. This is the most common way that we treat patients for Papillon treatment. However, sometimes due to tumour position, we need you laying on your front on your knees instead. Once you're in the correct position, we'll insert a muscle relaxant cream and gels to help the process be more comfortable for you. The doctor will then insert a scope to identify the tumour and decide whether you're suitable for Papillon treatment. If you are suitable, we'll insert a treatment tube for the X-ray radiation to be delivered through. This bit can be more uncomfortable and we can give you more pain relief in the room if you require it. Once the treatment tube is in the correct position, we'll go behind the screen to turn the machine on. The radiation will target the tumour to break down the tumour cells. The machine is only on for 1 to 2 minutes and you won't feel a thing whilst the radiation is delivered. We look forward to seeing you at your first Papillon appointment, and we're here to answer any questions that you might have throughout the day.